About hitting her in the face with that clip.
Hi, my name is Sarah Harp. This is my assessment of the eyes and ears for my assessment class at McKendree University. Mr. Harp, I'm going to ask you some few questions in regards to your ears and your vision, okay? Have you recently had any issues with hearing?
No.
Have you had any pain in your ears?
No.
Any ringing or dizziness?
No.
Do you have any exposure to excessive noise in your environment?
No.
Okay. And with your vision, have you had any issues, any double vision?
No.
Anything like that? Okay. Do you have contacts or glasses that you wear on a daily basis?
No.
Okay. Do you have any pain or redness?
No.
Itchiness, drainage from the eyes?
Nope.
And when exactly was your last eye exam?
September.
Okay. Very good. I'm going to go ahead and start my assessment with the ears, okay? And I'm going to first start by looking at the outside structures of the ear. I'll look at the auricle. We'll look for lesions, any deformalities, anything of such. We're going to make sure that the pinna lines up with the inner canthus of the eye, which appears as though that it does. At this point, I'm going to ask Tom to turn and look at me. I'm going to look at both ears. I'm going to make sure that they're both symmetrical. Make sure that they match in size and in color. The color of the ear matches the skin of the face. We'll look at the folds of the ear, make sure that they're all formed well. And it appears as though they are. So that would be definitely a normal finding. Now, if I do not have an otoscope, if I had one, at this point is when I would use it in the exam. For an adult, I would pull the ear up and back to get in to examine the ear. For a child, I would pull down and back. I would be looking at the, excuse me, I would be looking in the inside of the ear, in the ear canal. It would be a pinkish color. There wouldn't be any lesions. There wouldn't be anything scaly. There wouldn't be excessive amounts of cerumen. I would then look to the earlobe, or I'm sorry, the ear tympanic membrane, and it should be a translucent, pearly gray color. There should not be any perforations present. The landmarks should all be visible. There shouldn't be any bulging or any other abnormalities with inside the ear. Okay. You doing okay, Tom?
Yes.
Thanks.
You said a lot.
I know. I would not only do this on this ear, I would do it on the other ear as well. Okay. Now we're going to test your hearing. I don't have a tuning fork either. Those aren't usually things I keep around. I would strike the tuning fork, and I would place it in the back of the ear here, and this would be testing bone conduction. I would ask him to tell me when he no longer heard that. Once he told me that he didn't hear it anymore, I would bring it to the front of his ear, and I would place it there, and I would ask him to tell me when he heard that last as well. He should definitely hear it longer in front of his ear opposed to in the back of his ear. Okay, then I would hit the tuning fork again. I would place it at the top of his lip and on his forehead. What I would be testing for here is equality in both ears to make sure that he could hear equally in both ears. That would be the normal finding with that. At this point, I will conduct the whisper test.
Kool-Aid.
Okay.
Kool-Aid.
Okay, and that was within normal limits. That's a normal finding. If he could not have heard that, we would have had some issues at that point. Okay, so now I'm done with the ears, and we're going to assess the eyes. I'm going to start by checking the pupils. We would dim the lights for this in a normal exam, but for this purpose, we will not. We could try. Yeah, it's kind of dark. Okay, so I'm going to start with my pen line out. I'm kind of just going to bring it on the outside of the vision field. I'm going to bring it in, and I'm going to watch the pupils respond. They appear to constrict appropriately. Sorry, you see some spots. Now I'll ask you to follow my finger. Go in, out. And again, that's within normal limits, and that's a normal finding. At this point, I'll also assess the structures of the eye. We'll look at the eyebrows. They appear to be, they appear to be in normal limits. They don't, expand past the canthus. They're not extra thick. They appear to be normal. Now I'll do the eyelids. There's no lesions, no bumps or anything on the eyelids. As he has the eyelids closed, you don't see any tremors of any sort. When they're open, they do cover portion, the superior lid covers portion of the iris, but it does not cover any of the pupil, which is a normal finding. As you notice with his blinking, he does not blink excessively. It appears to be within a normal limit. So at this point, I will pull down. I'll look at the conjunctiva and the sclera. Sclera is white. Everything appears normal. Conjunctiva is a nice pink color. The lacrimal gland, there's no excessive tearing. There's no exudate. Do you feel any pain?
No.
Okay, so he doesn't have any pain. So all that appears to be within normal limits. Do you have any questions?
No.
Okay, at this point, if I had a salescope, I could do a more thorough exam. I don't, but if I did, I would check the light on my hand. In order to do a proper exam, I would kind of brace his head. I would stand at an angle, and I would lift his eyelid if I needed to get in to see a little better. I would be looking for the vessels, the optic nerve, the optic disc, and the macula. Should everything be within normal limits, we should be able the red reflex would be present and fairly easy to find. The retina, should kind of have a yellow tint to it. The optic nerve itself should be an orangish color. The optic disc, the margin should be well defined. It would be yellowish in color. It should be like normal size and shape. It should match on each eye. The macula can usually be seen if the eyes are dilated. Should the eyes not be dilated, sometimes it's constricted and it is a lot harder for an examiner to see at that point. You shouldn't see any exudate, any hemorrhages of the vessels, anything of that sort. Okay, so I'm going to go ahead now and ask you to look up, down, in, out. Okay, all of the muscles in the eye appear to be responding appropriately. At this point, I'll stand behind Tom and I'll ask him, we're going to check his peripheral vision. So I'll ask him when my finger comes into his field of vision. Are you ready?
No.
Okay, that is normal finding. That's good. So if you could go ahead and stand up for me, we're gonna do the Snellen chart. Back up a little bit. And what I need you to do is I need you to read the smallest line of the chart that you can without straining. Excuse you.
Pardon me. VZYACEGLNPRT.
Okay, very good. That he read it in 2020, so if you can cover up your right eye and read it again.
VZYACEGLNPRT.
Okay, good job. And your left.
VZYACEGLNPRT.
Okay, very good. So that is a normal finding. So you can have a seat, yeah. So now we're going to use the Rosenberg chart. It's going to test your near vision again. I'm going to ask you to read the smallest line you can at approximately 14 inches away from your face. Don't strain or squint or anything like that.
423-785.
Okay, cover up your left eye.
Yeah. 423-785.
Okay, now your right eye.
423-785.
Perfect. Okay, so that is also a normal finding. Do you have any questions or any concerns that you would like addressed today?
Nope.
Okay.
Good.
So that will conclude my assessment of the eyes and ears. Again, I didn't have a lot of the instruments I needed to do it appropriately. I do want to stress that everything I did with the right ear, I would do with the left ear, and vice versa, and the same with the eyes. If whatever I did with the left eye, I would also examine on the right eye. Thank you.